Welcome back to another edition of Our City. Last week's parade, the Union County St. Patrick's Day Parade, went off very well, and I want to thank the guests for being on the show last week. And this week's show is going to be a little special as well. On Thursday, March 15th at 9 o'clock in the morning, I'm going to attend the Elizabeth Development Company's business seminar. It will be held at the Embassy Suites, located at 95 International Boulevard, across from the Jersey Gardens Mall. And on Saturday, March 17th, at 6:30 in the evening, I'm going to attend the 96th anniversary of the Portuguese Instructive Social Club. This event will be held at the Portuguese Club, located at 417 U.S. Highway number 1. And if you need more information concerning these events or any other events, please call our Public Information Office at 908-820-4124. I ask that you please stay tuned after these messages, where I'm going to be talking with two young people from the city of Elizabeth who have landed a coveted role in the Broadway play Miss Saigon.
We're creating tomorrow's jobs today. Kean University.
Welcome back to Our City, where I'm pleased to be joined by Miss Elie Rapada. Elie, how are you?
Good.
And I'm also joined by her brother. No, you're Edelle. You're Edelle Rapada, sorry.
Yes.
I messed that up. You forgive me?
Yep.
Okay, and you're Elie,
Yeah.
right? Rapada.
Yeah.
And how old are you, Elie?
6.
And how old are you?
4.
4. And your dad's here too, right?
Yes.
And your dad's name is EJ,
Yes.
but you call him what?
Daddy.
Daddy, right? Now, before we begin, tell us a little bit about yourself. Like, what grade are you in and where do you go to school? You want to go first, Edelle?
Yep.
What grade are you in?
Pre-K.
And where do you go to school?
26.
You go to
29.
You go to school 29.
Yes.
Okay. And Elie, what grade are you in?
Kindergarten.
And where do you go to school?
School 29.
You're in the same school?
Yes.
So do you go to school together?
No.
No, you go separately?
Yes.
Okay. And what time do you go in the morning and the afternoon, or just the morning? Do you go all day to school?
Yes.
Yes?
Yes.
Yes. And you're in school all day too, right? So, tell me, you told me before the show started you have a best friend. What's your best friend's name, Edelle?
Abigail.
Abigail. And is she in school with you?
Yes.
Okay. And you and her have play dates together?
No.
No, not met, but you're friends in school?
Yes.
Okay. And Elie, who's your best friend?
Mason.
Mason. Okay. So when they watch the show, they can say, oh, you mentioned my name on the show, right?
Yes.
Yes. Now, so what made you try to get into the show? Now, who has the role of Tam on the show? You both do?
Yes.
And so you have it on the same night? No?
No.
So tell me, how did you get the role? Do you know?
We had to cut her. I had to cut my hair.
Did you have longer hair?
Yes.
How far did your hair go? Did it come all the way down to here?
It came all the way down to here.
It did. And you had to cut your hair to be on the show?
Yes.
What was that all? Did you like that?
Yes.
It's okay. You like your hair short?
Yeah.
You do? Okay. So, did you have to cut your hair?
No.
No. And so, how did you get the role of Tam? Do you know? Go ahead, Elie. How did you get to be in the play? Do you know how you got to be in the play? Did Dad help? Did your teacher help? Should I ask Dad?
No.
So, Dad, how did they get to be in the play?
Actually, we have a agent for years now, because I have like 5 children. So when my first daughter was born, we got an agent. And somehow she sent us this information that they're looking for the specifications that they qualified for, like the height, the weight, and the ethnicity. And so they got for audition, and that's how they got into Broadway.
So you had to audition?
Yes.
And you went to Broadway?
Yes.
And what did you do when you got there? Do you remember? No. They just told you had to cut your hair.
Yes.
Oh, did you come home and say, Dad, I have to cut my hair?
Yes.
And what did Dad say? He said, okay.
Yes.
Yes, okay. And so did you have to go and audition too?
Yes.
And how did that go?
Good.
What did you do? Do you remember? Did you say any lines or anything?
No.
No? So what do you do before you go there? How many nights are you there, I should say? How many nights are you in the show? Every night of the week? No. Are you in every night of the week? No. How many nights do you know? Do you know when you go? Do you have any speaking parts in the play?
No.
No. You sit there and smile?
No.
What do you do?
Be serious.
Oh, is that what they tell you to do? So you can't smile?
No.
No. And I'm trying to get you to smile. Come on, I want to see a cute smile. There you go. I got one, right? See? So, how do you get your homework done when you have to go to do the show?
We either take it on the train and we do it on the train, or we finish it at home.
Okay. And do you go together to the show?
No.
No, you don't go together?
No. Only one time we did.
Only one time you did. So, does your brother help you with your homework and stuff?
No.
No. Do you never help your sister with her homework?
No, because she doesn't have any homework.
Because she's in pre-K? Do you have homework?
Yes.
And who helps you with your homework?
Nobody.
You get it done yourself?
Yes.
Oh, good for you. So when you get to the show, do you go into a back door somewhere?
No.
No, where do you go in? You go into a door?
We go into a door that's front.
And you go into the front door. And then where do you go? Around the curtain somewhere?
No.
You go behind the stage?
No.
No? Where do you sit and wait for the show?
At the dressing room.
Oh, you have a dressing room. Is your name on the dressing room?
No.
No.
No. We only have faces of us, and we have we have tags of us.
And how does that? And so there are other kids in the play?
Yes. Yes.
And have you met them?
Yes.
And have you made any friends with those kids? Any of them your friends?
Yeah. Yes.
Yeah. Which one's your friend in the play?
Daniel.
Daniel. You like Daniel. Okay. And how about you?
Daniel too.
You both like Daniel. He's your friend. Where's Daniel from? Do you know? No. So, Dad, how do they get there? Do you take them over?
Well, sometimes if I have a chance, I drive to the city and bring them to Broadway, and then have to wait for 3 hours and then bring them home back.
So you don't wait inside?
Sometimes if I wanted to go inside, but I have to pay the ticket every time. So.
Oh, you do? Even the father?
Yes, yes, we still have to pay the ticket.
So, how many nights are they in the play?
Actually, they play 4 times a week.
They do?
But there's 2 times that have like backups, and then the other 2 is they're actually the ones performing for the whole entire show.
Really? So,
right.
So they have to go there 4 nights a week?
Correct.
Okay. And they're both in it together?
No, they don't want them to be together because they said like they have already happened in the past where siblings come together, and there was a problem with transportation and whatnot, and they don't have nobody to play.
Okay.
So it's always the 2 people in the show. So they split them together, except that one thing that Elie said that this kid was sick and they need a backup, so they invited the other one to go with them. That was the only time.
So I saw this play, when long time ago, before you two were even born, but I saw Miss Saigon, and I enjoyed it. It was a fun play to watch. Do you like the singing?
Yes.
Yeah. Do you get to sing?
No.
No. But do you like to listen to it?
Yes.
And how is the main actress? Is she really nice?
Yes.
And did she say hello to you and talk with you?
Yeah.
And Miss Saigon, she comes over and says hello to you? The older actors are fun people? What do you know?
Yeah.
Yeah. I got another smile out of you. So, were you in any school plays or anything before this? Did you have any other training to get these roles?
No.
No? You just showed up with your agent because you look good. Right? Come on, talk to me. Say something.
Yes.
Yes. So, so I asked you this question before. What is your family background? What is your heritage? You were half what?
Filipino and Lebanese.
Half Filipino and half Lebanese, right? And you have other brothers and sisters too?
Yes.
Who are they?
We don't have brothers.
You have other sisters.
Yes.
And what are their names?
Eliana and Ivana.
Eliana and Ivana. And how old are they?
10 and
8.
8.
10 and 8. So do they help you with your homework, Ellie?
No.
No, they don't help you with your homework either. You get it done yourself, right? Do they go to school here?
Yes.
Yeah? They go to school in Elizabeth?
Yeah.
So, are they happy for you
Yeah.
that you're on Broadway? Yeah?
Yeah.
So, would you like to do another Broadway show?
Yes.
You would? You'd like to do this again?
I will.
You will. You're enjoying this?
Yeah.
And how long will you think you'll be? How long do you think you'll be on the show for? Months or?
For the previous, Elie started in July until January of 2018, and then Edelle came on later, like September, until January. But right now they are auditioning for the Miss Saigon US tour around the country. They'll be touring around, so they're invited again to join the audition, hopefully this month or March.
Really?
But this time it's not going to be a stationary in New York City. They're going to be all around the country.
So they get paid for this?
Yes, they do.
They do. So the money that you make, you're going to be able to use it for college? Is that the plan, Dad?
It's a trust fund. Yes.
It's a trust fund. How cool is that?
They required us to.
They require you to put it in a trust fund.
Yes. Yes.
So the parents can't touch it, right? It's in a
Yes.
trust fund, and they get to use it for their education type of thing.
Yes, pretty much.
How about that? You don't even know what money is yet, do you? That's how you get.
They have a lot of money already.
Yeah, that's how you get the pretty dress you have on, and the clothes you have on, right?
I have more money than her.
Because you were in it longer, right? Yeah. So, you want to do this again, Edelle?
Yes.
Okay. And would you, if you do it again, would you come back on my show?
Yes.
You would. Okay. So I really want to thank you for being on the show today. It was absolutely terrific. So EJ, are there any other projects being prepared for them?
Yes, actually, Elie had an audition the other day. It's a movie. I think it's a TV series. But when my wife and him went there, they saw the other, Tams who were playing in Broadway also in the same auditioning as well. So we'll see.
Oh, so
We'll see. Yeah.
the other Tams were there too?
Yeah, they were also there too.
Oh, okay.
But those ones that they have like speaking lines, they have to say some things.
So what do they think of this? What is your perspective on what they're doing?
Yeah, in the beginning, we don't really think that they would love to perform until they get the opportunity. And when they showed up in Broadway, they were very professional. Actually, the adult performers told us a lot of times, like, they've seen a lot of kids in the show too, but they said like both of them really are professionally, performing, because some other kids would be like fidgeting, walking around, or making some noises on stage, which they're supposed to do. For them, they're very professional. They just stick and focus onto their roles and act it like that. And
I think that's terrific. Do you hear what
Yes.
Dad just said? He
so we're
thinks you
so
guys,
proud of them.
everybody else thinks you're great on the TV, on the play, right? You look really scared. Are you?
No.
No. Okay. So I want to thank you for leaving school today to come on the show, because you got out of school to come here, right?
Yes.
Yes. And I want to thank you for taking the time to do that, okay? So I'm going to go to a commercial now, and then you guys can go with Dad, okay? So if you just stay there. Can I say thank you one more time?
Yes.
Thank you. I want to thank EJ Rapada the dad, and also Edelle and Elie for taking the time to join us on the show. You two were great, and I really wish you well with your efforts at Miss Saigon, but I also want to wish you well in any other future roles you get, okay? Okay. Please stay with us after these messages, back with National Health Week and our health officer, Mr. Mark Collichio.
We're an American original, dependable, historic, nuanced, with all the comforts of home, even when you're just visiting. So we're celebrating for all that we've left untouched and all that we've changed. A place where the past meets the future. So consider this your invitation.
We've been celebrating here in Elizabeth for 350 years, and we're just getting started. Welcome back to the second half of this evening's show, Our City. For the second half, I'm pleased to be joined by Mark Collichio, our health inspector here in the city of Elizabeth. Mark, welcome to the show.
Thank you.
It's good to be with you.
Thank you. It's nice being here too, Mayor.
So, Mark, tell us a little about yourself here before we get going on the
okay.
on the issues that affect the public health.
All right. Well, first of all, I'm a born and raised Elizabeth guy. I mean, I remember playing in the North Elizabeth Little League when you were the president. In fact, I remember getting an award because I was the only kid that came to a game in a cab, and I remember that really touched you.
I did. You weren't going to miss. You got there in a cab.
That's right. My mother made sure, my mother, God rest her soul, wanted to make sure that I made that game, so she called me a cab because no one was able to take me.
I know. Can you imagine that? You got to be the only kid that showed up for a Little League game in a cab.
Yes.
Nobody else does that
No,
at 9 years
no.
old, 10 years old.
No, my mother, I have to say, my mother was very creative, so I miss her dearly, along with my father.
Yeah. So you're an Elizabeth guy, right?
Yes.
Oh, yeah. And
Born and raised.
born and raised. Now you started with us years ago, and then you left. Tell us about your career here.
I started in 1989 as an air pollution inspector. While I was an air pollution inspector, I went back to school to take the science courses I need to become a registered environmental health specialist, or health inspector, as a lot of people call them. So once I got my license, I worked from 1993 to 1990, like 4.5 or whatever, as a sanitary inspector. I then went to the city of Englewood, where I did the same thing. From Englewood, I went to the city of Newark because they offered me a position as a chief sanitary inspector in their division of lead poisoning. And that's really where I learned supervision. That was my first experience as a supervisor. And I was going to say I learned a lot working in the city of Newark. And then while I was in the city of Newark, I was going to graduate school because I wanted to become a health officer, and you need a master's degree to do that. So while I was going to graduate school, I was working part-time in the city of Elizabeth as a part-time sanitary inspector. So I was working in Newark 40 hours a week. I was working in Elizabeth roughly 15 to 20 hours a week and going to graduate school. And people ask me how I was able to do that, and I really can't answer that. I don't know.
Then you went to Morristown too for a while, right?
Yes. When I came back to Elizabeth, I was in Elizabeth for about 7 or 8 more years. I was promoted from senior registered environmental health specialist to assistant health officer once I got my license. And then eventually in 2003, the town of Morristown had an opening for health officer, and my predecessor, Mr. Serme, advised me pretty much that I should apply for it, to which I did, and I got the job. And I was in Morristown for maybe about 4 years. From Morristown, I went to the New Jersey Department of Health, where I was a program manager for sanitation and safety, where that encompassed overseeing youth camps, tattoo parlors, regulated medical waste. We did inspections on the state prison system. We did inspections for healthcare facilities and a whole array of activities. And from the state, I went to the city of Plainfield, where I became the health officer before returning to the city of Elizabeth in 2012 as the assistant health officer. And then in December of 2014, I was made health officer for the city of Elizabeth.
So what are your duties as the health officer, Mark?
Pretty much as the health officer, my job is to oversee all of the public health activities that go on in the city, which encompasses some different divisions. I oversee the housing division, the health division, The environmental health, public health program, you have an air pollution inspector, a public health investigator, registered environmental health specialist. They're the ones that go around inspecting restaurants, daycare centers, schools, youth camps, pools, and whatever. And right now, we're inspecting nail salons. I mean, and one of the huge problems that we have too, because regulations have changed, is childhood lead poisoning. All right, that's one of the things that we are tackling.
Being an old city, some of the paint that was used maintains the lead, correct?
Yes, yes. Yes, it's still in the paint, it's still in the dust, and you know, we have inspectors and nurses that do co-visits. They go out, they do inspections, and it's very time consuming, but we're able to get a lot of these places abated.
So National Public Health Week is upon us, and
Yes.
what do we do as a city to work within the realm of National Public Health Week?
Well, we pretty much promote our entire department, Health and Human Services. I mean, we team up. We team up and we have like a wide range of activities. We promote our services for the most part. We promote our clinics. We promote like our restaurant inspections. Like we provide a lot of information. We have HIV testing, we have rabies clinics, and a whole array of activities. I mean, we're still in the planning process for it, but we're finalizing it.
And we've had a tough flu year.
Yes, we have.
We lost a 7-year-old here in the city of Elizabeth, and the flu. What's different this year than previous years?
Well, you know what? Flu seasons are never the same. This year, the new strain is developed called the H3N2. All right, now you know what? There's a lot of factors. Flu is out there. Flu is in the air. We do the best we can to try to prevent it. I mean, which we'll get to in a few minutes. One of the things that I feel also contributes, besides this new strain, I guess if you noticed, we've had like drastic changes in weather. I mean, from 70 degrees to 40 degrees. And one thing that we learn in public health, and one thing I teach my students when I adjunct, is that the environment is always changing. And we need to adapt to the changes of the environment. But it's extremely difficult when you're dealing with 70 degrees one day and then snow the next. You never know how to dress. So what happens is a lot more people become sick. And then sometimes symptoms get worse and worse and can develop into the flu.
So you don't get flu from that, but your immune system gets weakened,
yes.
Right?
Your immune system can get weakened, and then you're exposed to flu viruses. And you know what? If you're not vaccinated, vaccination is wonderful. Vaccination is great. It's a great protection. It doesn't protect you from all the strains, unfortunately, but it's, you know what? It's better than having absolutely no protection.
So when you know, people are constantly wiping down doorknobs and wiping down banisters and everything else, and flu is in the air, though, right?
Yes,
it doesn't settle on doorknobs.
Correct.
Yeah, it's in the air.
It's in the air, yes. But through sneezing, wiping your nose, of course, I mean, viruses can certainly spread when you sneeze. I mean, we have these, we call them droplet nuclei. When we sneeze, all right, particles expel, which have the virus in it. I mean, even though it's airborne. So sanitation is extremely important. I mean, it's not the ultimate answer to prevent flu, but you know, it's something. It's doing something.
Is there an ultimate answer to prevent flu?
No, there's no ultimate answer. I mean, you know what? The best ways to really prevent it, you do your best. Vaccinate. I mean, I stress vaccination, getting your flu shot. All right, dressing appropriately, trying to adapt to the environment is a way. All right, staying home when you're sick. All right, specifically, I mean, if you're getting runny nose, if you're getting fever, if you're vomiting, specifically, and if you have a fever over 100 degrees, we call that a higher grade fever, and that's when you should seek your doctor.
How important is it to wash your hands, Mark?
Washing your hands is not only important to prevent the flu, washing your hands is important to prevent all types of illnesses, to prevent the spread of bacteria, bacterial organisms. It's one of the things that we look for in a restaurant. I mean, when we inspect food establishments, how often people wash their hands. Everyone stresses gloves, and wearing gloves is fine. I mean, it's a requirement to have barriers between, you know, your bare hands and what we call ready-to-eat foods, but it's no substitution for hand washing.
And Mark, one of the things that we often talk about is you said about flu shots and vaccinations. The city provides flu shots for the residents.
Yes, they do. The city provides various clinics. But however, I mean, the clinics are over. We have flu vaccine available, and you can certainly call the Office of Public Health Nursing at 908-820-4250 and obtain an appointment to get your flu shot.
And we would provide it.
Absolutely.
Mark, tell us about the symptoms of flu. You talked about a high-grade fever, which is over 100.
Yes.
And is that in adults and children? Or,
yes.
Yeah. Okay.
Adults and children. I mean, your symptoms of flu, I mean, you have cold-like symptoms, stuffy nose, a lot of sneezing, but fever, I mean, which sometimes can develop into a higher grade fever. All right, chills, sometimes nausea and vomiting, sometimes diarrhea.
So, Mark, does everyone exposed to the flu get the flu?
No. No, what I like to say is I like to call it what you say a crapshoot. Some people get it, some people don't.
And there's no way to there's no way to know that.
No.
And Mark, in the hospitals, do you get reports from the state when people get the flu, or do you get it only if people succumb to the flu?
If a patient goes to a doctor, we have a system called the CDRSS. It's called the Communicable Disease Reporting System, developed by the New Jersey Department of Health's Communicable Disease Service. And we get reports of all types of communicable diseases on there that we have to investigate. And if influenza is diagnosed or suspected from a doctor or a medical provider, then that is reported to the CDRSS. More so this year because of the new strain.
And Mark, one of the things that I found in dealing with this is you can't be diagnosed with the flu immediately, right? You have to grow a culture.
Yes, there are lab tests that are involved. I mean, doctors will diagnose you with the flu in an emergency room based on symptoms, but the real ultimate test would be a confirmatory lab result.
And that takes time.
And that takes time. That can take like a few days to a week.
But if you have symptoms, a doctor will prescribe Tamiflu or
yes,
or fluids in order to raise your blood pressure and things like that.
Yes.
Mark, tell us about the difficulties in dealing with the flu. Do people listen, I guess, is...
Do people... You know what? We try to advise people the best we can. All right? We put information out there through shows like this, through other organizations.
Brochures, right?
Brochures, different agencies that we collaborate with. And you know what? It's, again, you have some people that don't believe in vaccinations. Some people believe that it will never happen to them. And some people are under the impression that if they get the vaccine, they will get the flu. And that
doesn't happen.
No, that does not happen. A lot of people say that they'll get the flu the following day, where it actually takes a couple weeks to get into your system to build immunity.
Mark, I want to thank you for taking the time to join us on the show this evening, and appreciate all of your knowledge and input in helping the community stay safe, especially from this year's difficult flu virus.
My pleasure being here.
Thank you. I want to thank Mr. Mark Collichio, the health officer for the City of Elizabeth. I also want to thank Elie and Edelle Rapada for not only taking the time to join us on the show with their dad, EJ, but for their strenuous commitment to performing on Broadway in the role Tam in the show Miss Saigon. We'll see you next week on another edition of Our City.
We have some of the finest teachers in the country. And then they graduate. Kane University.